Hey everyone, we're going to talk about chapter 4, which is where we start to go into pain and pain theory. In this text, it does talk a lot about the management of pain because it is a text for all healthcare professionals, not just physical therapist assistants. So we will talk a little bit about the medical management of pain and the surgical management of pain. Even though it's not something that we do, it is something that we need to know about. So I'm going to try to keep it small and make it in small chunks. So hold me to that, okay? So first of all, we're going to talk about the etiology and the causes of pain. So what is pain, right? We think we all know what it is, but it is a subjective feeling. So pain is an unpleasant sensation or a feeling of discomfort that results from stimulation of pain receptors in the body, or when tissue damage is about to occur, the pain matrix in our brain can cause pain in absence of stimulation of nervous tissues. So that's a really interesting part of pain theory that is really sort of just coming about in the last few years. We're talking about nervous system causes of pain and not just actual physical causes of pain. So at its basis, though, when we first start talking about pain, it's discomfort that is caused by tissue damage, and it's a defense mechanism. So it's the pain is warning our body like there's something wrong, like take your foot out of the fire, or stop leaning up against that hot thing, or it's really cold out there, you better bundle up. So those nociceptors, which we'll talk about a little bit, are pain receptor nerves. They're trying to tell us like, hey, there might be something wrong. They're trying to defend the body. Pain, however, is guided and created and taken away by complex neural mechanisms that may not be totally understood. So in the cases of trauma, it's obvious many times what's causing the pain, but there are other types of pain that it might not be that obvious. So we've developed a lot of subjective scales to compare pain levels over time. I can't compare my pain to your pain, but I can compare my pain today to my pain yesterday. So that's where the subjective scales come in handy. A lot of times in physical therapy, we are talking about outcomes. And one of the outcomes that most people want when they go to physical therapy is they want their pain to go away. So we have to have a way to measure it. No one has yet developed the painometer where we could just put it on their forehead and say, hey, look, you're at a 4 out of 10 pain. That doesn't exist. And so we have to go with subjective scales. And I will talk a little bit later about different types of subjective scales. So the learning objectives for this chapter, I want you to be able to describe the characteristics and role of some different components of the neurological pain pathway. And we'll talk about each of these. One of them is a nociceptor C fibers. It's an identification of a nerve fiber, the spinothalamic tract, endorphins, and enkephalins. So I want you to be able to define referred pain and give an example of it, and we'll talk about that. I want you to be able to differentiate the characteristics of acute versus chronic pain and what is intractable pain. I would like you to be able to list several factors that can alter the perception of pain and the response to pain. So we don't just have like, oh, here, take this aspirin and your pain will go away. We have a lot of different perceptions of pain, responses to pain, and a lot of different treatments which are focused on altering the perception of pain. So it's really interesting. It's not straightforward. Because it's such an important part of what we do, a lot of people enter into the medical system and get referred into physical therapy because of pain. Pain is the symptom that sends people in. So we're going to start talking about it here. We're going to continue talking about it next quarter in our modalities class, and we will further dive into the depths of pain in clinical neurology in the winter. So lots of good information, lots that is not known about pain. So we're going to talk about what we do know. So lots of different things can cause pain in the body. Pain can be caused by infection, ischemia, tissue necrosis, stretching of tissue, chemicals, burns. In skeletal muscle, pain can result from ischemia or hemorrhage, so not enough blood or too much blood. Many organs, such as the liver, kidney, or brain, are characterized by pain receptors in the organ capsule, and the pain is felt when the capsule is stretched by inflammation. So stretching of ligaments and tendons and joint capsules can also elicit pain. A lot of these effects occur secondary to inflammation or muscle spasm, either to guard a joint or a painful body part, or to keep us from using it, or it might be referred pain from an abdominal organ. So we want to distinguish between somatic pain versus visceral pain. So somatic pain usually arises from cutaneous sources, from the skin, or from deeper structures under the skin like bone or muscle. Really, the pain gets conducted by sensory nerve fibers. So we have lots of sensory nerve fibers in our cutaneous and subcutaneous tissue, and those pain signals are conducted to the central nervous system by those sensory fibers. Visceral pain originates in the organs, and rather than being conducted by sensory nerve fibers, it's often conducted by sympathetic nerve fibers. So our sympathetic nervous system is part of our autonomic nervous system, and a lot of times pain in organs, whether it's acute or chronic, is conducted by the sympathetic nerve system rather than the somatic nerve system. So depending on the cause, pain can be sudden or short-term, and it can involve reflex withdrawal, like you touch something hot and you pull your hand back. It can be relatively continuous, such as when you have swelling or an infection present. So a lot of times when the pain is bad enough that it brings people into physical therapy, it's a sudden onset that we're talking about. But sudden onset, but continuous pain afterwards. So we'll talk a little bit later in the lecture about acute versus chronic pain.